Hi everyone, and welcome back to my channel. This is video 6 of the Breast Cancer Thriver series, and today's topic is breast reconstruction surgery after mastectomy. There are options to have reconstruction after a mastectomy surgery, and depending on the situation, you can start the process of reconstruction right in your mastectomy surgery. If your oncology surgeon and reconstruction surgeon are in the same surgery, they can coordinate and start the process right away. For me, I had to wait about a year and a half before they would do reconstruction on me, because they wanted to make sure all the cancer was gone, because if the cancer came back and then they'd have to take out the prophylactic breasts, then it would be quite a harder process. So they just decided to wait, and after a certain period of time when everything had been checked, then I was eligible for the reconstruction surgery. So the first thing that happens in your reconstruction process, this is also once again quite an extensive process. It's not a one-shot surgery. You have 2 surgeries and then a lot of things in between. The first surgery is where they put these things called tissue expanders under your skin to try to get ready for the breast implant. The first thing they do is they put this tissue expander, which is kind of like a little sack, and they just put it and it'll be flat. It might have a little bit of fluid in it, but they have to get your skin stretched over a period of time. They can't all of a sudden put the full breast implant in right away, because your skin stretches. What they do is they put this thing called a tissue expander, which is kind of like a little pouch, and it has this metal plate at the back of it. The first time you get, so that's surgery number 1 of reconstruction, is where they put the tissue expander in. For me, it was double mastectomy, so I had 2 tissue expanders. And then you have to start going to these appointments. I think it was either once a week or every 2 weeks. And they start to put fluid into those tissue expanders, and then your skin starts to stretch over time to be able to handle the breast implant eventually down the road. So one thing I was not really prepared for, although I do remember someone in I think it was either during chemo or in a doctor waiting room at some point, just talking to people who had gone through it. I found out that the needle that they use to put in fluid with these tissue expanders, it looks like it's meant for a horse. Like they're literally coming at you with this needle that's like about this long, and it's coming, and I have a problem with needles, FYI. If you have a problem with needles, you might not want to watch the rest of this video, but it was for me, it was really difficult to handle. I have a real problem with needles, and I always ask to lie down even when I'm giving blood in case I faint. So when I saw the size of the needle that they're coming at you with, and it looks like it's gonna poke right through you. Now remember, they had this kind of a metal plate. The needle comes and hits that metal plate, and then it stops, and it can start putting in the fluid over time. So that was one thing that was really quite shocking for me, was just the size of the needle. Now, if you don't have a problem with needles, it's probably not a big deal, but for me, it was quite a big deal to every few weeks have this honking big needle coming at you. That was kind of scary. But once I got over that whole needle thing, then I was okay. So I got used to the weekly routine of, okay, now you get more fluid in, you get more fluid in, you get more fluid in. And at a certain point, it's not, some people think that this is a real fun experience, like you're gonna have a breast job basically, and it's how fun this is going to be. It's not really quite as fun as you think it is. You think, oh, I'm going to have these really big breasts and it's going to be awesome. And that is the dream that some people have. But there is a certain limit of how much fluid can go in, and it does work in terms of your body size and things like that. You have the fluid put in, and whenever the point is when they say, okay, well, that looks like about what it's going to be, what your tissue expanders can hold and what your body in terms of skin stretching is able to handle, then they schedule you for the breast implant surgery. That's when they go in and they cut along the same scar that they've already just cut you open for the mastectomy. They cut along that same scar, take out the tissue expanders, and then they put in the breast implants. And now your skin is ready to handle those breast implants. And then you have to go through another process of recovering from that surgery. But it's not quite as traumatic as the mastectomy because you don't have the drains. However, it is quite a process of going through, getting ready. You might have some lymphedema. Again, you might have some swelling. Be prepared for that. So a few questions people ask is, what are the different sizes of tissue expanders? You're going to have to talk to your doctor about that in terms of what size implant you're going to have after your surgery, and it becomes more apparent as you move forward in the weeks with the tissue expanders. Another question that I get asked is it painful? And yes, it is quite, you do feel a bit of a tug and a stretch on the breast area as the tissue expanders are filling up. So it is slightly uncomfortable sometimes. And depending on what city you're in, what region you're in, you can go to different information events, or there's probably lots of webinars, YouTube videos out there of people that have gone through it where you can get some more detail. This is a basic idea of what to expect, a very high level view of how to do a breast reconstruction surgery after mastectomy. And I hope I gave you some little hints and things that from a survivor, thriver point of view of what I faced and what you could possibly expect. But always be sure to talk to your doctor and your care team in terms of what will be happening with your process. And let me know in the comments below if you have any other questions. Let me know what your experience was with breast reconstruction surgery after mastectomy, what that looked like for you, and let me know your experience with tissue expanders, reconstruction, and we'll start to build a community of people in the comments as these videos move forward. I look forward to connecting with you real soon.